You are enjoy watching I Love My Body TV, health and beauty tips for all. Hi friends, how are you? I pray to God for you to be healthy. This is your favorite channel, the channel that gives you useful health and beauty tips. Okay, watch this video about how to prevent heart attack. Tips number 8. Each year, more than 1 million Americans suffer a heart attack. Although heart disease remains the leading cause of death in the United States, great strides have been made in the last decade, both in treating heart attacks and in helping people who have suffered one resume a full, active life. General characteristics. The most common type of heart attack is caused by a coronary thrombosis, which occurs when a clot thrombus blocks one or more of the blood vessels that nourish the heart muscle. As a result of the lack of blood, part of the muscle may be damaged, and its ability to contract may be lost. This is known as a myocardial infarction. If the infarct is small and the electrical impulses that control the heart's contractions beats are not disturbed, chances for recovery are excellent. Coronary artery disease. Coronary thrombosis is one of the manifestations of coronary artery disease. As we grow older, our blood vessels tend to lose their elasticity, a process known as arteriosclerosis. The arteries may also become narrowed or clogged with deposits of fatty material called atheromas, a condition called atherosclerosis. Atherosclerosis is progressive and usually does not produce symptoms until there is significant blockage in the blood flow. Sometimes, in fact, the first symptom of this heart disease is a heart attack. Although the specific cause of atherosclerosis is not known, it has been found that certain risk factors help in identifying population groups that are more likely to develop it. 3 major risk factors are high levels of cholesterol and other blood fats, high blood pressure, hypertension, and cigarette smoking. Others include diabetes, obesity, a sedentary lifestyle, aging, being male, and heredity. Atherosclerosis begins forming as a fatty streak on the inner wall of an artery, usually at its branching out point, and disturbs the smooth flow of blood. As patches of fatty tissue build up, the inner wall becomes narrower, which inhibits blood flow in a more significant way. An artery continues to narrow as the tissue buildup progresses, and in time, the fatty depots. It becomes a hard mass of fatty tissue with a tough outer lining of cells, a plaque. As plaques spread and thicken, they erode the wall of the artery, which interferes with blood flow and makes it increasingly turbulent. This turbulence may trigger the blood to form a clot thrombus, partially or completely blocking the artery. Further, a fragment of the clot, embolus, may be carried by the blue DS stream and block an artery at some distant, narrower point. Heart attacks sometimes occur in people with little or no coronary artery disease. Some experts believe that a spasm or sudden constrictio of the coronary artery may be the cause of these heart attacks. It appears that a spasm may occur in a coronary artery that is totally free of atherosclerosis, as well as in one that is heavily affected by that condition. And this would explain why many people suffer angina and other cardiac problems without any evidence of underlying blockage in the arteries. Symptoms of a heart attack. A heart attack can come on gradually, preceded by several attacks of angina over days, weeks, months, or even years. Angina is the name given to the chest pain that arises when the muscular wall of the heart is temporarily deprived of sufficient oxygen. But a heart attack may also occur without any apparent warning, and in people who have never previously experienced any chest pain. Typically, the pain of a heart attack is a sensation of constriction in the central chest area. It may vary in intensity from a feeling of tightness to one of agonizing crushing or bursting. The pain may be continuous, or it may last a few minutes, fade and then recur. It commonly spreads to the back, jaw, and left arm. Although a heart attack may be precipitated by physical or emotional stress, the pain, unlike that of angina, does not subside when the stress ceases. Pain is commonly accompanied by shortness of breath, sweating, nausea, dizziness, and pallor. Some people experience a heart attack without any of these symptoms. This is known as a silent infarct, which may be confirmed by changes in an electrocardiogram or certain other hospital tests. A medical emergency. Most deaths from heart attack occur within minutes to hours after the onset of symptoms. Therefore, when sudden and severe chest pain occurs, an ambulance should be called immediately and the individual taken to a hospital. Denying that these symptoms represent a life-threatening illness may cause a delay that could be fatal. One of the major causes of death from coronary thrombosis is the development of abnormal heart rhythms in the hours immediately following the attack. Emergency treatment, therefore, concentrates on stabilizing the heart rhythm, as well as on relieving pain and preventing shock. In the hospital's intensive care or cardiac care unit, the rate and rhythm of the heart will be continuously monitored by an electrocardiograph machine. Blood tests to detect enzymes released from the heart aid in assessing the infarct further, and various medications may be given. Mood changes and feelings of apprehension are very common following a heart attack, and a mild tranquilizer is often given to the patient. Depending on the severity of the attack, the patient may be allowed out of bed within 3 or 4 days and be discharged after 2 weeks. Bed rest for more than a short time should be avoided, where possible, because it results in a rapid loss of the body's muscle tone and an increased heart rate on exertion. Physical activity is gradually increased and most patients are able to return to their full range of normal activity within a few months. Long-term treatment, depending on such factors as the patient's age and general physical condition, and the extent of the heart damage, a variety of different approaches may be taken to deal with the underlying coronary artery disease and to reduce the possibility of another heart attack. Changes in lifestyle. A number of steps can be taken to prevent or slow down the progression of heart disease. These include stopping smoking, exercising regularly, and adopting a low-cholesterol diet. Drug treatment. The use of drugs depends upon the nature of the heart attack and underlying coronary disease. Antihypertensive drugs may be prescribed to lower the blood pressure. Other drugs may be given to improve heart function, prevent chest pain, or lower the level of blood cholesterol. Other treatments. A number of other treatments, including coronary bypass surgery, are available. Obviously, their use depends upon individual needs. Summing up, heart attacks are a common occurrence, particularly among middle-aged and older men. An understanding of the risk factors involved in coronary artery disease, and the adoption of appropriate preventive measures may reduce the likelihood of an attack. If the typical pain of a heart attack does strike, prompt treatment greatly improves the chances of survival. Modern treatments enable most heart attack patients to resume a full, active life, although some changes in lifestyle probably will be required. A previous heart attack, advanced age, and diabetes are all factors in developing congestive heart disease. While all of these medical conditions are treatable, the damage done to the heart muscle cannot be reversed. Congestive heart disease is the heart's inability to supply enough oxygen and nutrients to meet the needs of the human body. It is commonly caused by a weakened heart muscle, hardening of the arteries, some lung diseases such as cancer and emphysema. Over 5 million Americans suffer from this disease, and it is believed that over half of them will die from their condition within the next 5 years. Congestive heart disease is the leading cause of hospitalization among senior citizens. A previous heart attack, advanced age, and diabetes are all factors in developing congestive heart disease. While all of these medical conditions are treatable, the damage done to the heart muscle cannot be reversed. Another risk factor that cannot be changed when dealing with congestive heart disease is having a genetic disposition to the disease. Genetic testing and knowledge of the complete family history can go a long way in indicating whether or not congestive heart disease is something that should be a concern for you. While some risk factors for congestive heart disease cannot be helped, there are many things that you can do to reduce the risk of developing this disease. These factors include such things as chronic high blood pressure, drug or alcohol abuse, thyroid disease, and even heart valve disease. The best course of action to take is to reduce your risk of developing congestive heart disease and improve the quality of life. Unfortunately, congestive heart disease is difficult to diagnose because it often occurs as a result of or in conjunction with other forms of heart disease. Perhaps the best hope for patients with this disease is to catch it early and begin treatment as soon as possible. Common vitamins and over-the-counter products can help with heart disease such as copper, calcium, magnesium, vitamin C, vitamin E, zinc, vitamin B, ginkgo plus and MSM. There is strong evidence that trace mineral copper is vital to the tensile strength of the coronary blood vessels. Scientists have found that people who drink hard water, water rich in calcium and magnesium, stand less chance of developing cardiovascular disease than people who drink soft water. Vitamin C is essential for defending the body against pollution and infection. It enhances the immune system and aids in growth and repair of bone and tissue. Vitamin C has shown to reduce cholesterol levels and lowers high blood pressure. Vitamin E supplies oxygen to the heart and the other muscles in the body, accelerates wound healing and aids in the functioning of the immune system. Zinc is needed for healing and maintaining healthy tissues. Amino acids are the building blocks of protein and are the vital components of skin, hair, muscle tissue, the body's organs, blood cells, various enzymes and hormones. Zinc also has a profound influence on the body's ability to resist disease. Vitamin B taken together as B-complex work as a team to perform vital biological processes, including energy production and efficient metabolic function. Ginkgo Plus supplies a comprehensive range of important nutrients needed for the proper functioning of the vascular system and for improving blood circulation to the brain. MSM maintains the development of the body's protein by forming flexible disulfide bonds between certain amino acids and in maintaining the strength of connective tissue. This allows water and nutrients to flow freely into cells and allows toxins to flow freely out of the cells. MSM increases athletic stamina and helps eliminate muscle soreness. MSM is a natural supplement that is getting a lot of attention due to its role in tissue healing at the cellular level. It is a natural organic sulfur that comes from rainfall and is found naturally in the human body. If you are at risk from congestive heart disease, then find a good health or professional prior to starting any type of home treatment. The signs and symptoms of heart valve disease are very hard to determine since many of them are so mild and can be attributed to a number of different conditions including asthma, heartburn, heart attack, or sometimes even pregnancy. Always have a conversation with your medical professional concerning your thoughts and physical symptoms if you believe that you may have any type of heart-related disease. Heart valve disease is a serious condition and should never be self-diagnosed. The heart is one of the strongest muscles and, arguable, it is the most important organ in the human body. It is responsible for getting nutrients and oxygen throughout the body by way of the circulatory system. It is divided into two halves, the atrium and the ventricle chambers. Between these two chambers are a set of valves that lets the blood flows in only one direction. Sometimes these valves become damaged and the person could suffer from some sort of heart valve disease. If left unchecked, this disease can lead to heart failure and even death. The signs and symptoms of heart valve disease are very hard to determine since many of them are so mild and can be attributed to a number of different conditions including asthma, heartburn, heart attack, or sometimes even pregnancy. Always have a conversation with your medical professional concerning your thoughts and physical symptoms if you believe that you may have any type of heart-related disease. Heart valve disease is a serious condition and should never be self-diagnosed. There are a few common symptoms of heart valve disease that you should watch out for. If you experience dizzy spells or faintness brought on by physical activity, shortness of breath, or chest pain while doing physical activity, or a blue color under your fingernails, or if your lips have a bluish tinge to them. These are all symptoms that you should bring up to your doctor's attention as soon as possible. Often heart valve disease is caused by a malformation of the valves, diseases, bacterial infection, or a general weakness of the valves that separate the two chambers of the heart. These deformities can include narrowed valves and leaking valves. Narrowed valves that can lead to valve heart disease can be caused by a number of things. One cause of this condition is congenital abnormality, a condition at birth that if it is severe enough has given you problems your entire life. Another cause, one that can be prevented through diet, exercise, and perhaps medication. Is degeneration of the valve through atherosclerosis, or hardening of the blood vessels that sometimes occurs in old age. The heart valve can also be caused by damage from rheumatic fever or extensive calcification. Heart valve disease doesn't always cause a life and death situation, although it can lead to major complications with the heart. Common vitamins and over-the-counter products can help with heart valve disease such as copper, EPA, garlic, ginkgo, iron, and lycopene. There is strong evidence that trace mineral copper is vital to the tensile strength of the coronary blood vessels. Studies of the Greenland Eskimos' lack of heart attacks have shown that eicosapentaenoic acid, EPA, lowers blood cholesterol considerably, even more than polyunsaturated fat does. It also triggers a major drop in triglycerides. Salmon oil is one of the best known sources of natural EPA. Garlic can counteract the result of high fats in the diet and to help reduce high blood pressure. Ginkgo Plus supplies a comprehensive range of important nutrients needed for the proper functioning of the vascular system and for improving blood circulation to the brain. Iron is an essential component of hemoglobin, the oxygen-carrying substance in red blood cells. Iron is vital for the production of blood. It enhances the immune system. Iron also aids in growth and repair of both bone and tissue by helping the body produce collagen. Lycopene is very powerful in quenching free radicals, as is L-glutathione. Ultra antioxidant allows cells to perform more efficiently with less oxygen, enabling sufficient oxygen to be utilized for the cells and organs that specifically need it. Okay friends, like this video, share your friends, tell your comments the comment box. Click on the subscribe button below to see new videos. Also press the bell button. Read description for more information. Thanks for watching.